first video in the series of the polycystic life of BBs. This is my very first vlog. Excuse me, I got a message. My very first vlog, I think that's what they call it. I'm not a professional vlogger yet, but my channel is just basically going to be geared towards, creating more awareness for those of us that are dealing with PCOS and other reproductive disorders, excuse me. Now, this channel is mainly going to be geared towards PCOS as I was just diagnosed, and so I'm going to be talking about my personal experiences with PCOS and my long ass road to diagnosis. But it is also going to be talking about some other reproductive disorders, because the fact is that if you've been diagnosed with PCOS or polycystic ovarian syndrome, you know that some other unfortunate reproductive disorders and issues can occur alongside that. So it'll be talking about a variety of things, and it'll be talking about my personal journey through this and where I am now and my past. And so this video is basically just going to start with me. I'm 30 years old, and I am a full-time student. I'm trying to get my BSN, which is my Bachelor's of Science in Nursing. I'm going to have my Bachelor's in Health Science here in May of 2019, so I'm very excited about that. That's the first step, but I'm still working to get into the accelerated nursing program so that I can get that nursing degree. So that's another reason. I just feel like if I'm going to be in the medical field, I just feel like this is something that I'm personally dealing with. I should be raising awareness and making more young women, and not even young women, any age of women. I just say young women because I know as a young woman, I didn't know what I was doing, and I didn't really care, and whatever. What do I have? I don't know. But, just raising awareness for PCOS and just knowing that this is a fight. This is really a fight, and it's kind of chronic. There's a lot of issues and things that we can deal with that a lot of people don't understand and don't realize, and I just want to put my story out there, make sure that you can see that you're not alone if you're dealing with this. If you have a long road, or if you've had a long road to your diagnosis, if you're in the process of being diagnosed, if you think you may have it and you're scared to go to the doctor, I want you to know that that's all okay and that you're not alone in this. And here's my story. So let's start off with my road to diagnosis. I'm going to try to cut some of it short because I don't want this video to be super long, because I tend to go on and on about things, and I want to go get very detailed. So let's just start with my first time going to the OBGYN. My mom got me started at 16, like I said, and I didn't have any issues at that age. I did ultrasounds, did tests, blood work. I was perfectly fine. And fast forward from about age 16 to about the age of 20, I started skipping periods. So I'd have a period 1 month, and then I wouldn't have one for 1 month. And then I'd have a period the next month, but it would be extra long. Instead of it being like 5 to 7 days, it'd be like 10 days. And I was like, what's wrong with me? Something ain't right. So I went back to the OBGYN, of course, and told him. He did ultrasound, did blood work, and found that, one, I had polycystic ovaries, but on the contrary, my blood work did not correlate with the polycystic ovaries. And so my blood work was within completely normal range. And for that reason being, he didn't diagnose me with the polycystic ovaries. I think back now, I should have told my mom. I should have went to a different doctor. I should have done something. But I didn't care. And I was of that age where it wasn't anything serious. I wasn't going to go to my parents to get advice for it. It was just like a regular doctor's visit. Like, it wasn't anything serious. So that was that. So he gave me birth control. The birth control regulated my periods. He never diagnosed with the PCOS ever, even though I did have the polycystic ovaries. I didn't have any nasty hair growth or anything that I have now. Oh, God. We'll go into that, too. So I didn't think anything of it. Fast forward from around age 20 to around age 25. Age 25, not only did I start growing the hair, and if you can kind of, I don't know if you can see, kind of like the regrowth, it's shaved, and also I'm doing a treatment called electrolysis, thermolysis, and I'll talk about that in another video. Freaking amazing. PCOS girls, it's permanent hair removal, and it's worked like a wonder for me. I've had to take a break on it to finish the treatment just because I was supposed to be having surgery today, so I was trying to save up for my time off, and it's a little pricey. But we'll talk about that in another video, like I said. So about age 25, I started getting that hair growth, and I was embarrassed about it. I was feeling down about it. And then I also started having a little bit heavier periods than I normally had. I didn't think much of it, but I started having those symptoms, and I was like, "What's going on?" But I didn't do anything about it. So fast forward. I'm sorry, I'm not a professional vlogger yet. So fast forward to age 28. Age 28 is when I moved to Ventura County. Like I said, I moved here to pursue my education for the most part, and also I'm in a serious relationship with my boyfriend that lives out here. We live together and have a great life out here. I love it. But anyhow, I moved out here for that, and at that point, I started to have the periods that were bad started getting worse. I mean, the pain level was crazy. Like, it was like an 8. The pain of the periods I was having, and I've always had normal monthly periods for the most part, except for that little spat I had when I was in my 20s. I've always had a normal monthly, so every month I was dreading it. Like, God, please no, I'm going to have to call off of work, and I'm going to have to miss my important class. I couldn't function. It was that bad, and the pain meds were really not helping. And I'm not one for taking, like, really strong pain meds, so the most I would go is, like, a, maybe 2 800 Motrins, but, like, that was like at most. For the most part, I would take an 800. I'm not big on pain meds like that. So I finally was like, I'm in this new area. I had the same OBGYN for about 10 years, and he didn't diagnose me with anything really. So I'm like, where am I going to go? I don't trust these doctors. I'm in kind of like a rural area-ish, really. There's like a lot of farmland out here where I live. So I was just like, I don't know about these doctors out here. I have no clue. I was very interesting. And so the only reputable medical center that I really knew of was Keck Medical Center, which was about an hour from where I live. And my mom's been there for hip replacement. I've had friends and family that have had surgeries and had cancer treatments, and they've just known nothing but good things about Keck Medical Center at USC. So I went there, found an OBGYN. She took me, and I went to see her for the very first time, went over my symptoms with her, let her know, hey, I'm having these really bad, strong, heavy, painful periods. The OBGYN looked at me and just did kind of like an overview, just a regular womanly check. And then she sent me over to radiology for like an ultrasound. Or for imaging for an ultrasound, whatever department that is. I can't remember. So they sent me for the ultrasound. I got it. The radiologist sent the report back, and I went to my follow-up the very next week. And they basically told me that the ovaries were perfectly normal. They said nothing about the polycystic ovaries at all. And mind you, I was diagnosed with the polycystic ovaries at like age 20. And all of a sudden, like 8 years later, at 28, I don't have them? What the hell? I was confused. So no polycystic ovaries. They were normal size, bilateral, whatever. The only issue on that ultrasound was my uterus. Now, my uterus itself was like of normal size, but the lining of the uterus was extra thick, and that's a risk factor for a lot of things. It could be a risk factor for precancer, cancer. It could also be fibroid, which is seemingly harmless but can be painful and cause you a lot of bleeding, and it could also have been polyps. The radiologist had suggested to the doctor to have me return for a second ultrasound at Keck 2 to 4 days after my period, no more than 4 days after. So I had my next period. I went like the very next day, the very second day, after my period. I got that ultrasound. I went back the very next week for the review of that. The doctor said that my uterus had completely resolved, and the size of the uterus was still normal, and the lining was great. It had gone down from 17 millimeters to 7 millimeters, and she said that was in perfect normal range, and there was no need for any type of a biopsy or anything like that. On this ultrasound, though, they did show that I had polycystic ovaries. So I'm like, what the hell? Am I going back? Polycystic ovary? No polycystic ovary? What is going on? I was very confused, and I was annoyed because the radiologist noted on my report, please correlate further or do more testing basically to check for polycystic ovarian syndrome. And so the doctor tells me she's sending me to an endocrinologist. Now, some of us that have done our research and know about PCOS know that it is technically an endocrine disorder, but it's also a reproductive disorder. And I'm like, PCOS is on your list of things you treat. Why are you automatically sending me to an endocrinologist? You haven't even treated me. You haven't done further testing to confirm the blood work. You haven't done anything at all. The only blood work you checked was just like, general blood work. So what the hell are you doing, lady? I was really confused and I was really pissed and annoyed, and I got real frustrated with that doctor and said, forget you, I'm done. Like, I was busy. I'm a full-time student. I was taking 18 units and it wasn't anything life-threatening. So I just said, I'm over it. I'll just deal with the heavy periods. About 6 months later, I got to the point where I couldn't deal with it anymore. So I did my due diligence. I searched and I searched and I searched, and I found my wonderful doctor here in Ventura County that I found, Dr. Ramirez. I went the very first appointment, and this was in September of 2018. So right after my 30th birthday. I'm 30 now. And actually, it was longer than 8 months. Going back to the time frame, I think it was longer than 8 months. But basically, after that, the pain got too bad, and I went to this doctor I'm talking to you about now. Dr. Ramirez was great. He had a wonderful bedside manner. I walked in, and he greeted me wonderfully, or he walked in and greeted me wonderfully. He was amazing, and he talked to me about the PCOS, went over some of the symptoms, and he goes, so why is it taking so long for a doctor to diagnose you? What's going on? He goes, I'm looking at a symptom right now. He goes, all that dark, thick chin hair you have? And I purposely let it grow out for this appointment. So, I want him to see. And so he goes, all the dark, thick chin hair that you have? He goes, that's a symptom right there. He goes, I only need one more symptom, and that's going to be your polycystic ovaries. And when I find those, I can diagnose you. It's not that hard. He said, so, and he tells me too, right then, he goes, I know that's uncomfortable for you, huh? It's embarrassing, you don't like it. There's nothing wrong with it. It's chin hair, it's hair, but I know for a woman you feel uncomfortable. And I go, yeah, I do. He goes, well, don't worry. We can treat that. We'll treat you for that. So I'm like, thank you, God. Immediately he does the ultrasound, and not only is he doing it and letting me see, he's interactive with it. And he gets that Doppler down there, and 2 minutes later, if that, he finds those ovaries, and he's like, polycystic ovarian syndrome. And I saw them with my own 2 eyes. I saw the polycysts in the ovaries. I had polycystic ovaries. So after that, hold on. I think the power's going out. Oh, that scared me. We've had really bad rains out here and windy, so I thought the lights were flickering. Anywho, he diagnosed me right then with the polycystic ovarian syndrome, and I was like, thank you. Again, came up the issue, though, of the thickened uterine lining, and he basically told me that he needed to check that and needed to be biopsied right away. It was about 17 millimeters thick. It was hella thick. And he was just like, this is something that needs to be biopsied. There's risks with, of course, polyps and fibroids, which are seemingly harmless for the most part. Granted, I think polyps in very rare cases can turn to cancer. Not only that, there was risk of possible precancer, endometrial hyperplasia, and also the risk of, what was the other risk? I can't remember. But basically, the main thing that I heard was cancer. And so he goes, this is not an option. In order to move forward with treatment, we do need to go ahead and get that biopsy done. So he scheduled me for what they call a hysteroscopy, which, just in short, if you don't know, it's basically where they stick sterile fluid up through the cervix into the uterine cavity, fill that uterine cavity with sterile liquid, the sterile fluid, and they put like little like laparoscopy type clips in there, like little handle they can move around, and there's also a camera that they put in there. So you could see all in the uterus. When he went into my uterus and he did the hysteroscopy, when I had my actual hysteroscopy, he immediately saw that I had a uterus full of polyps. And he said, you know what? I'm not going to say 100%, but I don't think you have to worry about any cancer risk. I'm pretty sure your lining is thick because of all these polyps and because of all the extra estrogen you've been emitting from this PCOS. So I was like kind of relieved, and they sent out the samples that he took for biopsies, and they came back exactly with what he said. They were non-cancerous, not precancerous, not even hyperplasia. They were polyps, and they just thickened uterine lining. There was nothing. And so he's, now during the procedure, just to go back, sorry, I kind of skipped over. During the procedure, he tried to remove the polyps. but it was too painful for me. I was just like, oh, screeching, eking, like moving. He was like, you can't move, you can't move. And I was like, okay. And so I like, was just like, I can't, Dr. Lee, it hurts. And he was just like, there is a uterus full of polyps. So he said, what I'm going to go ahead and do is schedule you for the same day surgery center to have a surgery. Basically, we're going to remove the polyps and do another procedure on you to basically remove some of the thick uterine lining, and hopefully the polyps don't grow back. There is a chance they could, but the procedure that I'm going to do on you, hopefully they won't. And we're also going to give you some treatment, hormonal treatment afterwards, so that it doesn't grow back. The other thing he told me was that now some of your symptoms are super, super, super similar to the symptoms of my endometriosis patients. This is what the doctor told me. And I'm like, okay, like, is that, like, what the heck? I got scared. And so he tells me that, and he says, I'm going to highly suggest you do the two procedures at once. So he suggested a operative hysteroscopy, which is basically the same procedure I had for the biopsy, but they're going to go in and operate in the uterus. And he suggested, highly, highly, highly recommended, a diagnostic and operative laparoscopy. So the hysteroscopy was not a option. The hysteroscopy to get the polyps out, that was a must. I had to do that. The laparoscopy was, I'm highly suggesting it, and if you don't do it now, I'm 95% sure you're going to have to come back and do it. It's safer to just get them done at the same time. So, and also he kind of convinced me by telling me too, with the surgery you're getting for the inside of the uterus, you're going to have to be off of work for about 4 weeks, because we don't want you on your feet. Even if you have a sitting job, we don't want you stressed. We don't want the bleeding risk, because they're doing like something to the lining of the uterus. I don't know what. So you're going to be off of work for about 3 to 4 weeks already. The surgery for the laparoscopy only is going to be an additional 2 weeks of recovery. But I'm telling you, I'm 95% sure you have those symptoms, that you have the endometriosis. And if you have it, not only is getting in there and removing it now going to help to preserve your fertility, because I expressed to him that I did want children when I found out I did have PCOS and I was scared. And he said not only will it preserve your fertility, we'll check everything. He said it'll change the quality of your life, which is number one. You're a student, you work, you can't be in this type of pain, and you can't call off of work every time your period starts. You can't miss class every time your period starts. You're going to school for health science and for nursing. You're taking important classes. This is going to change the quality of your life. If you have the endo, we will remove it. And he says, I've done this plenty of times. And, he goes, if say you're at a stage 4, I will do my best and probably able to get you back down to a stage 1 with the technology that I use. So not only did they opt to do that, they opted to do, like I said, the polypectomies to get the polyps out of the uterus, and also to do an ovarian drilling for the PCOS. And so I was like, okay, let's do this. Let's get it done. I'm done with these heavy, painful periods. I'm done with the moodiness. I'm done with the anxiety. He said that the ovarian drilling would help with the androgens and help with the PCOS. And we would talk about any further treatment after that. So fast forward to today, like I said in the beginning of the video, my surgery, I don't know if I told you I was having surgery, but I was supposed to be in surgery today, and it got canceled, unfortunately, at the very last minute, because I had a borderline EKG, and everything else was seemingly normal. My heart rate, sinus rhythm, my BPM is normal. It's about 65 beats per minute. It's perfectly normal. They don't foresee this being anything serious at all, and they said even if it were abnormal, it's very common for patients with an abnormal EKG to get clearance and undergo surgery just perfectly fine and safely, because surgery and anesthesia is so safe. So they said, yours is not abnormal, and honestly, you may go for your next EKG and it may come back completely normal. You may have been nervous. You may have a normal variation. May have an abnormal variation of your normal heartbeat. There's so many different things, but basically because they're not cardiologists, they said we just want to make sure that you are safe. Which I was like, thank you, at least they're not all about the Benjamins, all about the money, just, trying to get the surgery done and trying to get paid for that surgery. So I was very thankful for that. I was a little frustrated because I'd already taken the time off of work, but I think back now, and a lot of things have happened between yesterday and today, and now I have a flu and I have body aches and I'm sick, and I'm just like, maybe it's a God God's sign that I don't need to have the surgery. So any case, that is my story and on my diagnosis, my long 10-year diagnosis to PCOS, and I'm finally diagnosed. I want to share my story with you guys. I want you to feel comfortable to talk to me, reach out to me if you have further questions. I will keep this going. I'm gonna take you guys with me through this journey, and we're gonna fight this together. And I'll take you with me to the cardiologist on Tuesday too, because I need you to go through that process with me as well. We need to support each other, and I'll let you know what happens, and the next videos we'll talk about some more things, and of course I will let you guys know as soon as I get that surgery date, and I'll take you through that process with me as well, so that if any of you have to go through this surgery, you won't be scared, and you'll know that you're going to be okay, and that it's only going to make us better. It's only going to help us, and thank you so much again for watching the first video in the polycystic life of BBs, and I will put a link to my Instagram in the bio. Have a good one.